graduated from Korea University College of Medicine and have 30 years of experience in plastic surgery and studied clinical trials of stem cells for 20 years. There are a lot of recuperative cells in our body. There are cells that can recover after sleep, and wounds can sometimes become lifelong scars, but it can also recover. So among the cells that recover our body, there are 3 types of cells that can be used: hematopoietic stem cells, adipose-derived stem cells, and hematopoietic stem cells in bone. Hematopoietic stem cells can make our skin glow. As you know, there are many nutrients. In blood, there are hematopoietic stem cells. There are stem cells in between the fats that cause strong recuperative ability. So we collect those stem cells, select them, and immediately put them where we want. That's what we call adipose-derived stem cells, which is mainly used for plastic surgery, for beauty, and for youth. And when we are on periods or get treatments, bloods are continuously being produced. Nevertheless, what keeps producing blood inside the bones is hematopoietic stem cell. If we consider aging as a disease, we can treat aging. We usually talk about down aging when talking about stem cells, and that's really the reverse aging. In the end, wouldn't it be the perfect plastic surgery if we could go back to being 10 years younger? If we could turn back that 10 years, we could also treat diseases. Then if we could go back to about 20 years ago, aging, right? Even rare diseases can be treated. Right now, we are looking up to 30 years ahead. People who produce healthy stem cells tend to look great in photos because the face becomes much tighter, meaning cells have become much healthier. So no incisions are needed to give that lift, no laser treatments are needed to restore the skin and dermis. So the wrinkles and the skin are less saggy and the pores. It's possible to have that poreless smooth skin. We started with the heart at first, but just imagine how many concerns and how many stories from the patients we have for the past 20 years. Now it seems like we have almost cured diabetes in 7 days. It sounds a little absurd, but if you look at our 20-year story, we can strongly recommend the 7-day program. Diabetes treatment is in a highly advanced stage. Based on my personal observation for 20 years, I think there are no disadvantages. It's quite funny, right? But the advantage is that it makes cells healthy. It increases energy in those cells, which is obviously good. However, the disadvantage before was that it was very slow. There's nothing faster than cut and stitches. It could be thought that it has lost in that competition. Now it's different because it is so much faster now. Disadvantages? I don't think there are any. Modern medicine doesn't cure all patients. There are some areas where treatment is not possible. I believe stem cells will play a significant role in those areas. Actually, the story of stem cells is spreading and growing without us knowing. But the next version of stem cell medicine, like program medicine, various types of medicine right now, many people are talking about quantum these days. So we are looking at it very positively. Our bodies are constantly changing. Within 2 hours of extracting our body's stem cells, they go directly into the target cell. We are using honest stem cells, so in any country, it doesn't become a legal issue wherever you go. There are no after effects later on. I think it'll be such a shame if we don't use this. So, we are promoting the use of honest stem cells. The last era, this is an era where toxins are prevalent, isn't it? Electromagnetic radiation poisoning is also serious, along with COVID-19 after effects, etc. And there are many toxins such as cultural toxins and preservatives. I think that in order to survive this era, our genes need to be strengthened. Taking out my stem cells and using them, I cannot understand why one would not use these honest stem cells. So I strongly recommend it.